I'd like to spend a few minutes talking about the management of patients with chronic pancreatitis. And chronic pancreatitis is a different disease really than acute pancreatitis. It's a pretty common gastrointestinal disorder, and the characteristic features are the development of chronic abdominal pain, often where the patients are become addicted to narcotic pain medication or other types of pain medication, as well as insufficiency of the pancreas, both endocrine insufficiency and exocrine insufficiency. And again, endocrine insufficiency would manifest as diabetes, often where the patient would have to administer themselves insulin in order to maintain their blood sugar level. And exocrine insufficiency basically means that the patient has a deficiency of the digestive enzymes that are produced by the pancreas. And so these people will have frequent bowel movements that have a lot of fat in them and often float in the toilet. We call that steatorrhea. And they will also have weight loss and nutritional problems. So for exocrine insufficiency, the treatment for that is also supplementation, but this time we supplement the person with enzymes that they take in a pill form. The cause of chronic pancreatitis generally is repeated episodes of acute pancreatitis, and we can see that with all the different forms of pancreatitis. But one very common form of chronic pancreatitis would be related to alcohol abuse and chronic alcohol use. So you can see that those patients are very complex to manage because they may have a history of alcohol abuse and dependency, but also the treatment for their pain often can be with narcotics, and so there can be issues with chemical dependency there. And really, there's many treatments for chronic pancreatitis, including monitoring the blood sugar and just supplementing the enzymes for exocrine insufficiency. But one of the main goals of management in patients with chronic pancreatitis is to manage their pain and decrease their level of pain so that we can actually get them off of the narcotics and have them really live a healthier life. So really the indications for intervention or surgery in chronic pancreatitis are going to be complications of pancreatitis. So perhaps maybe there's an issue with the pancreas where it's pushing against another structure like the intestine or the bile duct. For those types of things, there may be stents that a endoscopist can place, but also those are things that we might need to do surgery for to bypass the blockage. Other things that we can see are fistulas or fluid collections, and again, these are managed by a multidisciplinary team. There's different techniques for treating all of them, including non-surgical and endoscopic therapies, but also surgery is effective in certain patients when selected appropriately. And then finally, I would say the majority of patients that we see for consideration for surgery with chronic pancreatitis would be essentially people who are narcotic dependent and have chronic pain. And for those patients, we have to determine what the appropriate surgical therapy is and select the patients well. We want to make sure that their blood sugars are well controlled. We want to make sure that their nutritional status is optimal. And we also want to make sure that any underlying causes of their pancreatitis are controlled. In any case, as I said, chronic pancreatitis management is extremely complex. It involves a multitude of healthcare providers such as gastroenterologists, interventional radiologists, nutrition, radiology, and surgery, all working together to try and optimize the management of the patient.